Good afternoon, thank you for joining us. I will start with today's statistics as usual. The total number of positive cases reported yesterday was 1,018. That represents 4.8% of the total number of tests and takes the number of confirmed cases now to 86,630. 391 of the new cases were in Greater Glasgow and Clyde, 162 in Lanarkshire and 123 in Lothian. The remaining cases are spread across the other 8 mainland health board areas. I can also confirm that 1,234 people are currently in hospital, which is an increase of 22 from yesterday, and 88 people are in intensive care. That's 3 more than yesterday. Finally, I regret to report that a further 32 deaths have been registered in the past 24 hours of a patient who first tested positive over the previous 28 days. And that takes the total number of deaths under this measurement to 3,459. Every single one of these deaths represents an individual whose loss will be causing grief and heartbreak. And yet again, I want to convey my condolences to everyone who has suffered the loss of a loved one. Now, I'm joined today by the National Clinical Director, Jason Leitch. Jason will help me to answer questions from journalists in a moment or two. Before we get to that, though, I want to obviously reflect on the restrictions which will come into force in parts of Scotland later today. From 6 o'clock this evening, 11 local authority areas in Scotland will move to level 4. These areas are the City of Glasgow, Renfrewshire, East Renfrewshire, East Dunbartonshire, West Dunbartonshire, North Lanarkshire, South Lanarkshire, East Ayrshire, South Ayrshire, Stirling and West Lothian. Infection rates in most of these areas have stabilised in recent weeks because of the sacrifices everyone has been making. But in all of these areas, the infection rate remains stubbornly high. And if the situation continues like that, the fact is more people will die or fall seriously ill. There is also a danger, if we don't get infection rates down, that our hospital and ICU services will become even more stretched as we move deeper into the winter period. And that will obviously affect the NHS's ability to treat COVID patients and also to offer services to people with other illnesses. In addition, we want rates to come down further before the Christmas period, when people might be meeting up with family members a bit more than is the case now. The fact is, the fewer people in the population who have COVID by the time we get to Christmas, the lower the risk of others being infected with it during that period. Now, it's very important for me to be clear that the risks would not be zero, which is why we must be very careful about any relaxation over Christmas, and people will have to think carefully themselves, even with any relaxation, about what they want to do or not. So the risk would not be zero, but they would be lower if there are fewer people in the population who have COVID at that time. So for all of these reasons, we decided and set this out earlier in the week to move these 11 council areas into level 4 for a period of 3 weeks until the 11th of December. And I want to say again, it's not a decision that we have taken lightly. I know how deeply frustrated people in these areas will be feeling right now. I know that because I do live in one of these areas, so I absolutely understand the sense of disappointment and the sense of frustration. But given the reasons and considerations I have set out, we believe this action is absolutely necessary. And I would ask you to remember that point, whether you agree or disagree with these decisions. That is entirely your right, but it stands to reason we would not be taking these difficult and potentially unpopular decisions if we did not think it was absolutely essential to do so. We know, of course, that as well as having an impact on individuals, these restrictions have an impact on businesses. That's why we've put in place extra support in addition to the UK-wide furlough scheme to help businesses through this period. Full details of the help available can be found at the findbusinesssupport.gov.scot website. There is a point I want to make to businesses, because I know how difficult it is at any time, but particularly as we approach the Christmas trading period, that we will do everything we can to help financially. But the most important thing all of us can do to help business right now is to get infection rates down. I understand that sometimes there can be a view that if we just take fewer restrictions to control the virus, life will be easier for businesses. But in the medium to long term, that would not be the case, because if we don't control the virus, then businesses will be affected more deeply and potentially for longer. So getting rates of the virus under control is in the interests of all of us, including business, no matter how difficult it feels right now when we're living with these restrictions. Now, detailed information about what level 4 means and indeed what level applies to your local authority can be found on the Scottish Government's website, and I would encourage all of you to go on and familiarise yourself with the restrictions in your area. There is a postcode checker. If you put in your postcode, you can find out what level your local authority is in and what that means for you in terms of the restrictions in place. But let me just take this opportunity to very briefly summarise what the restrictions will mean for people specifically living in level 4 areas over the next 3 weeks. Firstly, we are asking you to stay at home as much as possible. Reducing interactions with other people, hard though this is how we will bring infection rates down. And the more we do that, the faster we hope these rates will come down. Also, as is already the case and is the case in all parts of the country, with the exception of Orkney, Shetland and the Western Isles, you should definitely not visit other people's homes just now. You can still meet outdoors, of course, in groups of up to 6 people from 2 households. And although we all know the characteristics of a Scottish winter, I would encourage you, if you can, to get outdoors and perhaps meet up within these limits with others in that way. But as I said a moment ago, the advice to people in level 4 areas is to try to stay at home or as close to home as much as possible over these next 3 weeks. Non-essential retail will close. Essential indoor retail can remain open, so there is no need for anyone to rush out and stock up on supplies. Shops that sell food will still be open, although we are asking people obviously to comply with all the social distancing rules and other precautions whenever they are in essential shops. Level 4 also unfortunately sees the closure of close contact services, hairdressers and beauty salons, of visitor attractions, leisure and entertainment settings and indoor gyms. Hospitality premises will close for this period, although there is an exception for takeaway services. And of course, anyone who can work from home should continue to do so. So basically, except for some very limited purposes, including childcare, caring for someone who is vulnerable, exercise, shopping for essential goods, our advice to people living in level 4 areas is not to go out and about if you can avoid it over this 3-week period. If we all try to abide by that, then we will get these infection levels down more quickly. And the final point I would make before I move on to the issue of travel is to remember this, and I say this for context and perspective, not because I think it is going to make anybody feel that much better. But this is not just something we are living with in Scotland right now. We are today seeing a significant part of the country, the most populated part of our country, go into level 4 restrictions. But much of our country will not be in level 4 restrictions, and we want to keep it that way if we possibly can, which is why the points I'm about to make on travel are so important. But we see in England right now, the whole country of England is in a lockdown similar to our level 4 restrictions. Northern Ireland government last night announced that as of a week today, they will go back into effectively a full national lockdown. Wales has had similar restrictions. We see similar restrictions in many countries across the world. As I say, that doesn't make anybody feel better, but this is a global pandemic, and many people in many parts of the world are living with the same restrictions and being asked to make the same sacrifices as we are right now. Now that brings me on to the issue of travel. I can confirm, as you will have heard me do earlier in the week, that also from 6 p.m. today, the guidance that we have given about non-essential travel in recent weeks will become law. And that means if you live in a level 3 or a level 4 area, you mustn't travel outside your own local authority area unless it is for an essential purpose. You can find the list of essential purposes on our website. Overall, you can travel if you have a reasonable excuse, and we give examples of what that might be. So childcare, caring for a vulnerable or older person, exercise that you can't reasonably do within your own local authority area within a very short distance. Obviously, if you have to travel associated with somebody's end of life, for example, or for a hospital appointment. So there are examples of essential travel, but if you don't have to travel for an essential reason, then you mustn't leave your own local authority area. People living elsewhere in Scotland mustn't travel into level 3 or level 4 areas, again, unless it's for an essential purpose. And there must be no non-essential travel between Scotland and other parts of the UK or the Republic of Ireland. Now, there's a lot of attention, rightly and understandably, on this aspect of our restrictions in Scotland, that we're asking people by law not to travel to England unless it is essential. But remember, restrictions like this have been in place in Wales for some time, where it is already not permitted under the law to go to Wales if you live in other parts of the UK. And right now, the restriction in England is do not leave your home. So again, these are tough restrictions, but we are not alone in having to live with them as we seek to control this virus. Now, in addition, we are continuing to advise very strongly against unnecessary travel overseas at the moment, and that includes advice not to go overseas on holiday right now. Now, I know people have been asking, why are we making it against the law, depending on where you live, to travel to an airport, but not against the law to fly to another country? So let me be clear about this. Just because it's not against the law to travel overseas does not mean we think it's okay to do it right now. This is, as I've said a few times already today, it's a global pandemic. And it is for that reason that we have, in recent months, repeatedly advised people not to travel overseas unless for an essential purpose. And you will have heard me at this podium say that many times. Some people have also asked if you would be more likely to get refunds on flights or holidays booked if we did make overseas travel specifically against the law. That does not follow. Your entitlement to a refund depends on the terms of your travel insurance. For all these reasons, our advice is not to book non-essential overseas travel right now. And that brings me back to the basic point here. Travel anywhere in a global pandemic carries potential risk, whether that is the risk of importing the virus or within Scotland allowing it to spread from high prevalence areas here at home to low prevalence areas. So these travel restrictions, nobody likes them. I don't like them, but they are vital in helping us minimise these risks. And in a particularly Scottish context right now, they are vital in helping us avoid having the whole country in the same level of restriction. It is these travel restrictions that mean, even although the central belt has to be in level 4, we can avoid the Highlands or Edinburgh or parts of the country with lower prevalence being in level 4 too. So it is vital if we want to maintain that targeted approach, and I hope continue to avoid a national level 4 type lockdown, that we abide by these essential restrictions. All of these restrictions are tough, I know that, I don't underestimate it, but they are essential. They are about helping us reduce the spread of the virus. They are about helping us protect our NHS and make sure it can cope. And they are about trying to give us the best possible chance of having some ability to see loved ones at Christmas without that risk being massive. And that is going, as I said yesterday, to be a difficult balance to strike, but one that we are resolved to try to do. The final point I want to make, I hope, is a bit more optimistic. These restrictions are difficult and we are all thoroughly scunnered and fed up with them, and I'm not going to ever stand here and pretend otherwise, because I feel that same sense of being utterly scunnered and fed up as the rest of you do. But we do now see a possible end in sight to all of this, and I think it's really important that we don't forget that. In the last 2 weeks, we've had really encouraging news about a number of possible vaccines against COVID. The Health Secretary made a statement to Parliament about that yesterday, which set out the Scottish Government's plans for a vaccination programme. And set out our current planning assumption that, depending of course on the vaccines finally being approved as safe, depending on the flows of supplies that we need, but if all that goes the way we hope it will, she set out that we may be able to vaccinate 1 million people before the end of January. That's within touching distance. And then, of course, the rest of the adult population will follow after that. So there is a very real prospect now for all of us of a substantially more normal way of life being returned to us by the time we reach the spring of next year. And I hope that encourages us. It won't make the next few weeks feel any better, but it hopefully will strengthen our resolve to stay safe ourselves, keep our families safe, keep others safe before we reach that point. Because if we all do these things that are difficult now, we hopefully reach that point of safety with as few people dying as possible, as few people becoming ill as possible, and with the overall impact on our society being minimised. So please, in the difficult days and weeks that lie ahead, try to keep your eye on that light that is now on the horizon. Of course, the level 4 restrictions are just one level of restrictions and they will come into force today. But remember, everybody across the country should be complying with the restrictions in their areas. Let me just very briefly, before I finish and open up for questions, remind people what these are. In all parts of the country, apart from Orkney, Shetland and the Western Isles, please do not go into other people's homes. That is the single most important and effective thing we can do right now. It's also the toughest thing, but it is the most effective thing we can do to try to limit the spread of the virus, unless, of course, you are going into somebody's home for an essential purpose. If you're meeting outdoors or where it's possible in an indoor public place, limit your gatherings to 6 people from no more than 2 households. The one exception to that is level 1 areas where those limits are now groups of 8 from 3 households, but the general rule is 6 from 2. Remember to avoid car sharing, keep working from home if you can, download the Protect Scotland app. And finally, remember facts. They remain the most important basic things all of us can do to try to keep each other safe. Remember face coverings, remember to avoid crowded places, clean your hands, clean hard surfaces, keep 2 metres distance from people in other households and self-isolate and get tested if you have any of the symptoms of COVID. I'm going to end there, but I do want to just take the opportunity to thank everybody for everything you're doing. I know today feels difficult for all of the people that live in the 11 council areas. It doesn't feel easier for people outside these areas either. But this is necessary in order to get us through these next, hopefully final few months of this pandemic with as little impact on life, health, society and the economy as possible. So thank you for being patient and sticking with it. I will now move straight to questions, starting with Aileen Clark from BBC Scotland.
Good afternoon, First Minister. On business, can you give some reassurance to businesses in Tier 4 that they can confidently plan to reopen on the 12th of December? And is that for all business, whether you're in retail or hairdressing or hospitality?
Level 4 restrictions in the areas that go into level 4 today will be lifted on the 11th of December. Before then, we will have to make an assessment based on up-to-date data at the time about what level these areas then go into. Will they go back to level 3 or could some of them go to level 2? We can't make that assessment right now because we need to wait and see what the data is, but the level 4 restrictions will lift on the 11th of December. Ewan Petrie from STV.
Thank you, First Minister. Can you just clarify, for those looking to plan ahead, can you confirm restrictions may be lifted at midnight going into Friday the 11th, so businesses could look at reopening during the day that Friday? And what hope can you offer people heading into level 4 that it won't be extended beyond that date?
I've just set out level 4 restrictions will be lifted on the 11th of December. When they come into effect at 6 p.m. today, they will be lifted at 6 p.m. I think on the Friday of the 11th of December, that full 3-week period. The key decision we will have to make before then is what level different areas go into. I believe that level 4 for these council areas will mean that overall they spend less time in level 3 than they would if we had just left them in level 3. But whether they will be able to go leapfrog level 3 and go straight into level 2, or go to level 2 via a short period in level 3, we cannot make that assessment right now. But level 4 restrictions will be lifted. Bruce Mackenzie from ITV Border.
Thank you, First Minister. You talked a little bit about the cross-border travel arrangements, but for a lot of these communities, crossing the border multiple times a day is just a way of life, and there's a fear that they might be criminalised as a result of this. I wonder if you can tell us any more about how that cross-border stuff will be policed.
Well, the first thing to say is that if you live in a border area, before I answer the question in detail, remember the context of this. Before today, it was already effectively the case that you couldn't cross the border if you lived in England into Scotland, because the rule in England right now is that you can't leave your home without reasonable excuse. All we are saying is you can't leave your local authority if you're in a level 3 or 4 area without reasonable excuse. That is not easy, but so let's not forget that this border restriction is not simply being created today. But the more detailed point is this one. If you live in a border area, north or south of it, but I'm focusing on the north, obviously, because it's the part that the Scottish legal restrictions apply to, the exemptions for reasonable travel, essential reasonable travel, also apply. So if you live in a border area and your closest shop is just a couple of miles south of the border in Carlisle, you can still shop there for your essential shopping. Similarly, for exercise, or if you have to go for one of the other essential purposes. So some of these journeys will be able to continue. But if your journey is not essential, it's really important you don't make it right now. You know, I know this is not easy, but there are just some basic facts when you're in a global pandemic of an infectious virus. Travel helps to spread the virus. It basically means that if I was infected and I travel to another area, I risk taking it there, and if I infect somebody there, I could spark off a chain of infection. And an area that I go to that may have very low prevalence, in a couple of weeks' time will have higher prevalence because I have travelled there and taken the virus. Similarly, if I live in a low prevalence area and I go to a high prevalence area, if I get the virus from somebody there and take it home with me, I risk the same thing. So this is just a basic part of how you stop a virus spreading. And I think it's really important that we all understand that. And the more we can abide by these things and stop the virus spreading, the shorter the period of time restrictions like this have to be in place. So I take no pleasure at all in having restrictions like this. It's not, politicians, generally speaking, try to avoid doing things that might be unpopular. So I'd ask people, whether you agree or vehemently disagree with these things, if I didn't think they were essential, why would I be telling you that these things had to happen? Because it's not in the natural instinct of a politician to do things that people might not like or think or don't find popular. So even if you vehemently disagree, believe me when I say these things are essential to control a virus. On enforcement, the police have set out, just as they did with face coverings becoming law, enforcement will not be a first resort for the police. They're not going to stop every car. We are asking people to abide by the law, just as we ask people to put their seatbelt on when they get in their car without having a police officer having to check that they're doing it all of the time and people comply because it's the law and they know it's for their own safety. If the police come across somebody who's breaching these regulations, they will point that out, try to encourage them to rectify that. And only if there is flagrant breach would the police use enforcement. It will be a last resort, but it's important that it's there because these restrictions are so important. Do you want to say more about the importance of limiting travel, Jason?
I can. You've covered it very well, First Minister. The basic public health principle is not tricky. And public health advice is often unpopular, but the basic principle is don't travel between high and low prevalence areas, whether it's West African Ebola or global coronavirus, whether that's a Greek island, New Zealand, Somalia or Edinburgh. Don't move between high prevalence areas and low prevalence areas. Now, countries then choose what region, city, piece of the country to use for that description. We have chosen local authority restrictions to make that distinction, and that's where we think we can get the most result. So if you are in a 3 or a 4, I'm afraid stay within your 3 or your 4. And if you're in a 4, you can see us also just ramp up that advice a little bit today to say, please stay at home as much as you possibly can. And that's to allow the prevalence to fall over time. The only other thing I would say is sometimes it feels abstract as a human, as an individual. You don't think you've got the virus, so therefore, what on earth risk could you pose if you moved? Well, you may have the virus. You won't know you've got it until you show symptoms. That could be 10 days away, and you could have 10 days of transmitting that virus between now and then, and that's why we need you not to travel.
Peter Smith from ITV.
Thank you, First Minister. I noticed that the NHS Greater Glasgow and Clyde had given an update a couple of days ago saying that they now have 700 COVID patients in hospital. Can you please, looking at the hospitals across the level 4 areas, just how critical is the situation for these Scottish hospitals now? And do you have a sort of a plan in mind for what it needs to get to over the course of this level 4 lockdown?
So hospital capacity across Scotland is broadly about 85% at the moment. Obviously, there will be variations within that. It is highest in Greater Glasgow and Clyde and Lanarkshire. I think it's a bit higher, certainly my most up-to-date figures that it's a bit higher in Lanarkshire than it is in Greater Glasgow and Clyde. Those working in our health services will be feeling the pressure right now. These services are stretched, but they are coping and they are doing an admirable job. We have seen over the last couple of weeks hospital admissions and ICU admissions broadly stabilise. You'll have heard me report on some days slight reductions in the overall numbers in ICU and hospitals. There's a slight increase in both today. But we know that at the current levels of infection, we will continue to see more hospitalisation. If that level of infection continues, we'll see more hospitalisations and more intensive care admissions. And the other danger point there is that even small increases from that high level of infection could take a situation where hospitals are broadly coping, albeit difficult, into one where those services are overwhelmed. That's why we've got to get that down. And you know, the basic point here is that every time we stop somebody getting infected, then we stop the possibility that they will become very seriously ill and need hospital treatment, need intensive care treatment and potentially die. So, you know, we need to get infection levels down for that reason, as well as the reason of protecting our National Health Service. But I'll ask Jason to say a bit more about hospital capacity.
I spoke to a few hospitals this week. I spent quite a lot of time with Hare Myers Hospital in Lanarkshire, and they are feeling it. They are genuinely feeling it, particularly those who are at the front door and those inside COVID and ICU. So we have 237 people in intensive care today, not all COVID, but remember other diseases still exist. So people are still having transplant surgery. People are still having major trauma. So intensive care needs to flex in order to manage this new disease that we didn't have 11 months ago. That has a cost, therefore, to the staff, to the resources, to everything else we're trying to do. That's why the fundamental first principle is get the prevalence down, and that reduces admissions and that reduces intensive care. So in the last week, we've had 44 admissions to intensive care and 550 admissions to hospital. That's too high. That's why the advice this week was to introduce these restrictions to get those numbers down, but they start with every single infection.
Ali Fortescue from Sky.
Sorry, First Minister, can I just ask, without these restrictions, how long did you predict before we would be reaching capacity in some of these hospitals?
You can see the answer to that question in the information we published on Tuesday, local authority by local authority. Obviously, a number of local authorities all are in the same health board area. But you can look, I don't have the sheets in front of me right now, but in Greater Glasgow and Clyde, for example, and in Lanarkshire, we were predicting pressure up to capacity into December. So we model that on a 2 week, 4 weeks, 6 week basis. But you can go onto the Scottish Government website and see the specifics for each local authority and each health board area.
I would only add that capacity is a relative term, so people shouldn't be frightened to come to hospital. intensive care is available, but if you need more intensive care, you need to stop doing something else. We don't have people idle waiting for this. So it means stopping theatres, it means moving people around the system. So we can manage, but the way to manage successfully is to reduce the prevalence so we can treat diabetes and hip replacements and COVID at the same time. But if you end up in hospital with COVID, you're at very high risk of serious illness, and that's why we need it to stop.
Thanks. Ali Fortescue from Sky.
Thank you, First Minister. People we've spoken to in queues outside shops in Glasgow the last few days say that they're worried restrictions might not ease. They might not be able to get what they need for Christmas. With police saying that they're not going to be actively enforcing the travel ban, what can you do, or what will you do to stop people going to Edinburgh and other lower tier areas for their Christmas shopping?
Well, the police will enforce if they think it is appropriate to enforce. This is the law, and people are law-abiding, and I think the majority of people will abide by the law. If we can't, though, maintain a tiered approach that allow us to have lower restrictions in areas of lower prevalence, then, as England is doing already, we would have to consider having the same level of restrictions across the whole country. But I don't think that should be something that becomes inevitable. So I'm being very open with people that if we want to keep this targeted, proportionate approach, travel restrictions are a key part of that, and people should abide by them, as I believe they will. Remember, essential shops will remain open, so you don't have to worry about getting essential food supplies or anything like that. Shop online over the next 3 weeks if you can, in order to get things that are not available in essential shops. But do not, if you live in Glasgow, as I do not travel to Edinburgh to go shopping, because not only would you be breaking the law in doing that, you'll be risking taking the virus from Glasgow to Edinburgh and putting people in Edinburgh at risk. And that's the reality. It sounds harsh, it sounds pretty blunt, but given what we face right now, but also given what we know we can do to try to limit the risks, I think it's important for me to be blunt and straight with people. So that's what I'm seeking to do. Callum Clark from Bauer.
Good afternoon, First Minister. On the vaccine plans that were announced yesterday, in terms of the 2,000 figure for number of volunteers, are we on target to reach that come the end of the start of next month rather? And secondly, on the volunteers themselves, will anyone with no previous medical experience be administering the vaccine?
People who will be administering the vaccine will be, given the appropriate training to do that. Remember, while COVID vaccination will be new to Scotland and every other country, vaccination is not new. So right now we are in the midst and well into the flu vaccination programme that happens every year, and as that gets to completion, some of the vaccinators that are involved in that will be available to be part of the COVID vaccination programme. We're on track in terms of the plans that the Health Secretary set out overall with the vaccination programme. Yesterday she set out some of the detail of that. She set out what we hope to be in a position to achieve. She also set out that there are some things that remain uncertain. While we've got really promising news on a number of vaccines, none of those vaccines have final approval yet, so we hope that will change in the very near future. And while we have indications for the supplies that we are likely to get and in what order we're likely to get them, we obviously have to see that materialise. So there are uncertainties in this, but we are planning on a number of assumptions that, if they come good, will allow us to vaccinate people in the quantities, in the order, subject to any changed clinical advice on the order of priority, in the timescales that the Health Secretary set out yesterday. And as she said, she will keep Parliament and the public updated as some of these currently uncertain factors become a lot more certain in the period ahead. But Jason, do you want to say a bit more about vaccinators?
So we've got to align two things which sound easy but are actually quite difficult: the supply of the vaccine and the nature of that vaccine, and the people and the resources to be able to give that vaccine. It's a big logistical exercise. We are on track. I think yesterday the Cabinet Secretary said we have over 950 vaccinators ready to go when we get the first batch of vaccine, but we won't need 970 because we won't have enough vaccine. And then 2,000 will get us into a time when we have many, many more vials of this vaccine. The other part of your question about who will do it, appropriate clinical people will do it, and it will depend what the nature of the vaccine is and the packaging and how it works. Some vaccines need mixed with another liquid, some vaccines don't. So the level of skill will be adjusted according to which vaccine we get in which batch at which time. So we have to think about that all the time. But the health service is very used to creating teams with senior clinical leaders and then skilled people all the way down that pyramid to the people who actually give the vaccine to the human beings in Scotland.
Many thanks. Tom Eden from PA.
Thank you, First Minister. Good afternoon. I was just going to ask about the vaccine as well and ask you to allay any fears that money could be a problem for the rollout of a vaccine. Earlier this week, Kate Forbes, the Finance Secretary, said that the current plan was for already received Barnett consequentials would pay for the rollout of the vaccine. I was just wondering if there was enough unallocated consequentials to fund the rollout of a vaccine safely, quickly and effectively.
We will roll out the vaccine safely, quickly and effectively. That is what we are focused on. As there will be on many things, there will be discussions about funding between the Scottish and the UK government, and at times you'll hear us talking about that because it's important that we are open and accountable. But I don't want people in all of this worrying about that. You know, if I can say this, and you take it in the way I intend, is that's for the Scottish and the UK government to worry about and to work out between ourselves. Obviously, being open with you as we do it, but we will deliver a vaccination programme because that is the way out of this pandemic, and all of us, for a whole variety of different reasons, health, life, economy, and just how we live and interact with each other, that is vital. And the cost of not doing that would be much greater than any cost of doing that. So we will deliver that programme, and we will have the discussions and make the arrangements around the financing of that in the normal ways, even if it is not an entirely normal situation. Conor Matchett from the Scotsman.
Thank you, First Minister. I've been speaking to teachers this week who are very concerned that their safety fears around COVID-19 are not being taken seriously by the Scottish Government and local authorities. To give you a couple of examples, sadly without being able to name the teachers due to issues around them being worried about losing their jobs, two teachers, one in Edinburgh and one in Renfrewshire, said that they were refused work from home status despite having serious respiratory conditions, that both of which are considered disabilities under the Equality Act. So I'm wondering if you can say what more, especially after Wednesday's debate, the Scottish Government is going to do to help teachers feel safe in classrooms. And secondly, should teachers in level 4 areas who were previously shielding, be teaching in schools where they are not fully socially distancing, or should... Sorry, let me start that question again. Should teachers in level 4 areas who were previously shielding or are considered high risk be forced to teach in classrooms or take sick leave rather than be allowed to work from home? So
there's many or a few different but obviously related parts to that question, so I'm going to try and take them bit by bit. In terms of the last part of the question about people in the shielded category, now I'll ask Jason to answer this question from a clinical perspective as well. But in terms of teachers who, or anybody working in a school, not just a teacher, I should say, first of all, in level 4 areas, we do give advice about any children that were in the shielded category should learn from home and not at school. In terms of teachers, these are conversations they should have with their employers, and that's true of anybody in the shielded list living in a level 4 area. I set some of this out the other day, so if it is possible and safe and people feel assured that it is safe, we're not saying that shielded people as an iron rule should not go to work, but there have to be conversations with employers to satisfy and assure that that is safe. If there are further steps that need to be taken to make workplaces safe, and that includes schools obviously, then those should be made. And the letter that will be arriving with people in the shielded category in level 4 areas from the Chief Medical Officer will double as a fit note for anybody, and I'm not just talking about teachers here, who can't work because it would not be safe. These are not individual discussions I can have with everybody in the shielded category. It's important that these discussions happen with employers, and in the case of teachers, that's local authorities. But the safety of people is paramount in these discussions, and I think that's a really important point to stress. More generally on the question about safety in schools, we do take concerns very seriously, and we are not dismissing or refusing to listen to these concerns. It's because we take them seriously that we asked Public Health Scotland to do the analysis that it has done and published earlier this week, looking at the first term, the 9 weeks after schools went back in August up to mid-October, and to look at the numbers of infections amongst young people in schools, to give us a sense of what the prevalence around that was. Now, what that found, as we set out this week, that three quarters, almost I think slightly more than 3/4 of schools had no cases amongst pupils in that whole 9-week period. Of the schools that did, about half of them only had one single case in the 9-week period. So that there have been cases more in secondary schools than in primary schools, but at quite a low level. And it doesn't, of course, always mean that young people who had the virus got it in school. What we find is that any issues of infection in schools tend to reflect community transmission. There will be cases, I'm sure, of school transmission, but that is not what is driving transmission. It is community transmission that risks creating cases of infection in schools. Now, that report was about pupils. In terms of teachers, there has been work done, I think, if my memory serves me correctly here, by the ONS, the Office of National Statistics, that has looked at infection levels amongst people who work in education compared to people of similar age in other employment. And what they find is no particular difference there. Now, that gives us a level of assurance that there is not an increased risk to teachers or to pupils by dint of being in school. But we're not complacent about that. That is why there is guidance in place about mitigations, and it is why we have always said, and have done actually, is we will change that guidance if the case is made. So we've changed it on face coverings in school, for example, on more than one occasion. So we will continue to listen, and we will continue to take seriously the concerns that teachers, parents, young people themselves, or anybody else who works in a school has. But at the moment, based on everything we know, our judgment is that the harm that is done by not having young people in school as normally as possible, that harm is bigger than any risk that we think there is right now around transmission of COVID in schools, because we know that young people being out of school for extended period of times as they have been this year is not good for their education, and it's not good for their overall well-being. So because we've arrived at that judgment, we've done so carefully, making sure we're taking account of all of the evidence we can. And because we've arrived at that judgment, it doesn't mean we're dismissing the concerns of teachers. We will continue to listen to that. It means having taken account of all of that, that's the judgment we've arrived at. But we'll continue principally through the Education Recovery Group, which the Deputy First Minister chairs, to make sure that we are responding and addressing concerns as they arise. Jason, do you want to say a bit more from a clinical perspective?
Two brief things. One is you can be absolutely certain the advisors take education and the safety of education seriously. For one thing, I live with a North Lanarkshire teacher, and you can be absolutely certain that she forces me to take it seriously, along with all of her pals and her wider circle of teachers and educators and learners. The difficulty here is, as we set generic guidance nationally, we need the individual conversations to happen at school and local authority level. And the two examples you give are them. We can't have each of these individual conversations. So what we've said is exactly as the First Minister laid out. If you were formerly in the shielding group and you cannot do your job from home, then you should have a conversation with your head teacher, with your local authority, with your employer, and think about ways to make that as safe as you possibly can. And then you should be able to go to your work. If you cannot do what you do in some form working from home. And we realise that's really difficult for individuals, because the individual cases and their fear is, of course, something we want to take very seriously.
Thanks. David Ball from the Herald.
Thank you, First Minister. You said yesterday you would potentially consider hospitality businesses in level 3 areas. being able to shift their opening hours from 12 p.m. till 9 p.m. Can I ask from a public health perspective what the sort of danger of allowing that move is, or is this sort of a sensible compromise to help out businesses? And also, as we come out of the pandemic, the Welsh Government expects about a third of workers to carry on working from home. Is the Scottish Government factoring that sort of potential culture change into its plans to restart the economy? And will things like public transport networks need to be overhauled if commuter numbers don't return to normal?
On that final piece of the question, I think I've said all along, I think it is unlikely and possibly undesirable that we come out of this pandemic and just go back to everything as it was. There are many aspects of life right now that we're all desperate to get back to normal. We want to see our families normally, we want to be able to hug people we love, we want to be able to go to the pub or out for a meal or whatever it is we enjoy doing. We all want that to go back to normal, but there's a lot of things, you know, around the inequalities of life, around you know, some of the working patterns that perhaps contribute to those inequalities that we shouldn't just allow to drift back to normal if we can avoid it. And you know, there's also opportunities in how we might come out of this pandemic differently and better to contribute to some of our other objectives like tackling climate change. So there's some big things to think about there. I think it's also important that we don't kind of rush to, you know, set, you know, numbers around all of this, because it may take a bit of time for things to find the new equilibrium and settle. There'll be lots of people working from home now who really want to get back to an office or a work environment. There'll be others who actually find that working from home suits them better. There'll be people at the start of the pandemic who thought working from home would suit them better, who might have changed their mind after 8 or 9 months. And I know some of these people personally. So there's some big things to think about here. But I think having been through something as traumatic as this pandemic has been on all sorts of different levels, as disruptive as it has been, I think for a whole variety of reasons, we shouldn't necessarily just allow ourselves on everything to go back to normal. There is an opportunity to think about some of the things that were wrong with society and the economy before this and try to fix them as we come out, while we try to get the things that were right and that we all loved back to normal as quickly as possible. So on the Welsh example, you know, without going into kind of numbers and targets around that, I think I would agree on the broad sense of that, and that will have implications for other things, public transport, city and town centres, for example, and that all has to be part of our thinking in the period ahead. On the point about hospitality, I said I would consider that proposal, which I understand has been sent by some hospitality businesses. We haven't done that yet. I work on the basis that if people who are being affected by this pandemic and the restrictions put forward proposals about how the impact could be lessened or made, you know, less difficult, we have a duty to consider that. We won't always be able to agree with these proposals. So what I'm about to say, please don't take as a verdict on that particular proposal, because we haven't properly considered it. But sometimes what businesses will propose are different ways of you know, the hours that are restricted, which allow them to have more people through their businesses. And from the business perspective, that is entirely understandable. But from the public health perspective, the reason for the restriction is to reduce the number of people coming together. So sometimes it may not be consistent with the public health objective. And that's why we have to make a careful assessment and come to a balanced view. So, you know, if a restaurant is saying, well, you know, instead of making us close at 6 o'clock, or, you know, let us open later and close a couple of hours later as well. From a business perspective, I get that, because it allows a dinner service. But if it means that actually a lot more people are going to be coming together, it might not be possible from the public health perspective. So these are just the careful assessments we've got to seek to do. Dan Vavers from The Sun.
Good afternoon to you both. What are the key drivers of transmission of the virus at the moment? And is patients and staff catching it in hospitals one of them? And secondly, just on the vaccination programme, as it stands, the plan is for the wider population after the priority groups to start getting vaccinated in the spring, and with that to conclude in the summer. But we're hoping to get phase 3 results from the Oxford AstraZeneca vaccine in the coming weeks, and the signs around the data so far are very encouraging. And given the UK has ordered more doses of the Oxford vaccine than any other, if everything works out as it's hoped it will, could that vaccination timetable be sped up?
I'll hand over to Jason on both of these points once I've briefly addressed them. On that latter point, I'd be cautious about that. Our assumptions all assume that all of the vaccines that the UK government, or the main vaccines that have been procured, all get approved and licensed, and that we get the supplies we're expecting. So our assumptions are based on all of that coming good. And AstraZeneca, the Oxford AstraZeneca vaccine, is very much part of our planning assumptions already. On the point, and this, Jason will be able to say more about this, but you know, people, I hear from businesses all the time that say it's not pubs that are spreading the virus, it's not restaurants, it's not hairdressers, it's not. The point is, it's not an individual place that spreads the virus. The virus spreads by people coming together, and it spreads from one person to another. What we've got to do, and that risk is increased in particular environments. So, you know, where there's not good ventilation, or where people are maybe disinhibited and will come closer together. Or, you know, where there's people crowding into small places, but it's people that spread the virus to each other. And why we have to reduce certain settings or restrict certain settings is because these are the settings where people are more likely to come together in ways that exacerbate that risk. And we know that's in people's own homes, which is why the most difficult restriction of all is staying out of people's homes, and in hospitality settings. Now, as we restrict these places, then clearly places where people can still go will be more prominent in the kind of places that people are reporting to test and protect. So shops, for example, as people are going to restaurants and pubs and other people's houses less, then shops and hairdressers rise up the list as these places reduce. It doesn't mean that suddenly the risk in these places has got any greater. It's just that that happens to be where people are still going. So, you know, that's the point there. We have to restrict the way and the occasions where people are coming together in ways that the virus can spread. And that's the really difficult thing about this, but it is the reality of what we're dealing with. But Jason will give you a much more coherent answer to that than I've just done.
Not more coherent. The virus spreads in three ways. It spreads by droplet, it spreads on surfaces, and it spreads by aerosol temporarily in poorly ventilated areas. So go back to where those places are. So it can only spread in homes, workplaces, or leisure areas. So they're where people gather, either by touching surfaces, or by speaking, or being together, or touching each other, or all of these other things we now know. So therefore, the First Minister is absolutely correct. The league table of places that test and protect tell us about changes according to the restrictions you have, and it's exactly the same in Hong Kong as it is here. It's the same everywhere in the world. That's why these horrid restrictions are about limiting the number of times you interact with other human beings. It's horrid. And as I said at the beginning, you don't know you've got the virus. Everybody who catches it is surprised when they catch it. Every single person. They don't think they caught it. So therefore, you could be a surprise and spread it to somebody else. To your vaccine question, the numbers you've seen so far are with a very fair wind. That means all the phase 3 trials would work. That means all the safety data would be good. It's all the regulators approving them on time and quickly, and then we would get to the numbers that we're beginning to think about. AstraZeneca hasn't published its phase 3 data yet. It published its phase 2 data, which is very encouraging, and I don't want to remove hope, but let's be cautiously optimistic about what the vaccine can do for us. And if AstraZeneca, having submitted safety data, then can ramp up its production even faster than the fast production they've already predicted, then of course we will move quicker. But the companies are going as, they're building new factories for vaccine, never mind using existing infrastructure. So I think they're going as fast as they possibly can. They've done 8 years' work in 8 months, let's remember, to get the whole world this vaccine, not just Scotland.
Rachel Watson from the Mail.
Can I just follow up quickly just to say regarding the hospitals part of the question and the first question, is that a concern regarding...
Publish, and your colleague Chris Busson regularly asks us about this, we publish the levels of what's called nosocomial infection on a weekly basis. There's a 3-week time lag in that data because of the time it takes to properly verify some of this, but that looks at the cases where infection has definitely been acquired in a hospital where it might have been or where it's difficult to determine. Those rates are very low. I can't remember this week's report. I think that the definite hospital onset was maybe just over 1% or around between 1 and 2% of all infections. But we work very hard, or I'm saying we, people in the health service and in the front line, work very hard through infection prevention and control methods to reduce that risk as much as possible, and that will continue to be the case.
That's right. When you look at what we've learned about this virus, we're now better at protecting both staff and patients and residents. Of course we are. Healthcare associated infections are a risk. Scotland leads the way in reducing that risk for all infectious agents, and we've had to learn how specifically to reduce the risk from this one. And it would appear in wave 2, the numbers are much, much lower than they were in wave 1, for example, and that would suggest we're learning as we go.
Mark McLaughlin from the Times. Oh no, sorry, Rachel Watson from Mail.
Thank you, First Minister. I just wondered if you could update us on the expansion of asymptomatic testing, and particularly for designated visitors to care homes. Will that be in place before Christmas to allow longer visits from family and friends for residents of care homes?
No, I can't do that today because the Health Secretary is going to set that out in a statement to Parliament next week, so I will let her do that. We are finalising the plans around that. It will include the timing of testing for visitors to care homes, but it will also set out our plans for the use of lateral flow testing in other asymptomatic groups, which will be wider NHS staff and potentially other groups of workers, and also our plans for geographic use of mass testing using these lateral flow devices. But the Health Secretary will set that out in Parliament next week. Mark McLaughlin from the Times.
Afternoon, First Minister. I was interested to see that the COVID-19 advisory group paper on school closures, or the lack of school closures, was substantially based on a paper by Ben Goldacre, the author of Bad Science. And what he said was there is no increased risk of transmission either in people who work with children or who live with children. So even households where a teenager and an elderly person share a household, there was no increased risk there. So why is the advice still for grandparents that they can't visit their grandchildren, given that the pattern of risk seems to be the same as teachers and pupils? And also, can you understand, despite what that science says, why teachers, a lot of teachers are terrified to go to work? Because, you know, we're told that at school there's an acceptable risk, but then when you become a fresher at Murray House, there is no acceptable risk and you're at serious risk of dying. And then when you graduate and go back into school, you're back into the category of acceptable risk again.
You're using a lot of terminology there that I just wouldn't, I wouldn't necessarily associate with or agree with. I'm not going to try to answer your question because you've summarised a lot of quite complex evidence. If you have questions for the advisory group subcommittee on education about what they've drawn on to reach the advice, we will get those questions and put them to them. I'm not a scientist and I'm not going to try and answer that question based on extracts of secondary pieces of advice that you've quoted to me right now. I think it's probably better to do that in a more systematic way, unless Jason wants to have a go.
Only to say that, Mark, I think you would understand that the minutes might not contain every single piece of evidence that those scientists have at their disposal or in their long history of coming to that meeting with knowledge and experience of how they do that. I haven't read specifically Goldacre's piece. He tends to write in broad terms, taking evidence from other places. I know him, and he's a good evidence-based scientist. Remember, risk is relative. We make judgments about what should be open and what should be closed because you simply cannot take the risk to have everything open. And the public health benefits of school are so important that to keep them safe is really, really important to us. And just one final thing. I don't think the majority of teachers are terrified to go to work. I think the majority of teachers want to go to work and realise why it's so important that they do so. That doesn't mean we should underestimate the fear, the genuine worry that some have, and we should do everything we can to mitigate that.
But the main thing we do to reduce any risk in schools or any other settings is to get community transmission of the virus down. That's why, to do that, we have to make judgments about the parts of our society that we close, the parts that we try to keep open. So the reason the adult population are being restricted right now in going to visit family members or going to the pub or going out for a meal is to try to get community transmission down, which is in the overall interest of keeping schools safe and able to operate more normally. Tom Peterkin from the P&J.
Good afternoon, First Minister. I was just curious to know what stage your discussions with the UK government were about the proposals for a mega lab in Scotland, and whether you had any insight as to whether it's likely to be located north of the Forth, and if so, where?
The discussions are ongoing. I have no particular update that I can give you today, but part of those discussions is, and part of what Scottish Government and our partners have been seeking to do is identify a suitable location for any such mega lab. But to the best of my knowledge, certainly in my most recent advice and update on this, that has not been determined yet. Dan Sanderson from The Telegraph is the last question.
Thanks very much, First Minister. I was just wondering what your message was to members of minority religions in Scotland who might be looking at all this effort that's going into saving Christmas and wondering why similar measures weren't put in place for them. And are you concerned that it could undermine compliance in those groups going forward? Aren't they entitled to feel we're not really all in this together if there's one rule for the majority but not for minorities? And also, could we also just get an update on how discussions are going with the UK government over the relaxation of rules that will be put in place? Are you broadly on the same page, or are there disagreements there? And if there are disagreements, might there be a slightly separate plan in Scotland, or will it be a Four Nations approach? Thanks.
There's no update on that since the one I gave at around about the same time yesterday in Parliament. We had a discussion on Wednesday. We've asked our officials advised by Chief Medical Officers to bring us a proposal. I have not yet seen that proposal. I don't anticipate any great disagreement, but we've not seen the proposal yet. On the first part of your question, I have repeatedly said from here that many of our minority communities have already had forgive the shorthand here, it's not meant to offend anybody in any way in case it does, but their equivalents of Christmas in terms of celebrations and festivals. And I do think we've got to remember that while the majority of us, even some people in our minority communities will mark Christmas in some way, there are other really important occasions throughout the year for parts of our community, and we've got to remember that. Muslims, I represent a very big Muslim population in my own constituency. They've had Eid celebrations disrupted because of this. We've had other celebrations as well. Last weekend, Diwali, for example, and Hanukkah is coming up. But we do take account of this to the best of our ability. I specifically said in Parliament on Tuesday that one of the reasons, not the only reason, that we were determined to try to lift the level 4 restrictions on the 11th of December is that will allow the majority of the Hanukkah celebrations to take place outside the level 4 restrictions, not with no restrictions, but outside the level 4 restrictions. So I am very clear that we have to take account of Scotland and the priorities and needs of our country, reflecting all of the diversity of it, and we'll continue to try to do that. That concludes the questions today, so my thanks to those asking them, my thanks to Rachel for the BSL interpretation and to Jason for his assistance with the answers, and thanks to all of you. I know today's a tough one given what's happening at 6 o'clock, and I'm not going to try to sugarcoat that in any way. That is difficult for people living in these 11 local authority areas. I do live in one of them. But these decisions are necessary for all the reasons I have set out. We need to get the levels of infection down in these areas in order to try to minimise loss of life and impact on health. We need to get them down to make sure that our health services can cope over a winter period when all sorts of other pressures might materialise and make life difficult for the National Health Service. And we need to get them down ahead of the Christmas period where, notwithstanding any advised relaxation or allowed relaxation of rules, we know there will be potential mixing between people, and we need to make sure that we are minimising those risks, albeit we continue to have to make sure we're careful around that because there will be risks regardless. So for all of these reasons, I ask people to abide by these restrictions. I don't expect you to like them. I don't expect you to be delighted about them or anything like that, but please stick with them because they are essential to try to help us get through this next, hopefully final period of the pandemic as safely as possible. So please check what the restrictions are in your area on the website. Please don't go into each other's homes right now unless you're on Orkney, Shetland or the Western Isles. Please remember to limit any outdoor meetings to 6 people from 2 households unless you're in a level 1 area. And remember facts. If we all abide by these things, we will get through this quicker and we will get through it more safely than we otherwise would. So thank you very much for listening. Thank you for all you're doing. And please spread the message to those who are not able to join us today. I'll see you back here on Monday at the same time.